Anemia is the most common disorder of the blood. There are several kinds of anemia produced by a variety of underlying causes. Dr. Felix Horng of Hoag Memorial Hospital Presbyterian in Newport Beach will explain the symptoms and the treatments for this disorder.
Anemia, the technical definition, is a reduction or deficiency in hemoglobin, which is the major molecule that transports oxygen to our body's tissue. And why that's important is because oxygen is needed by our tissues to properly function, and without oxygen, tissues can actually be destroyed. So anything that reduces the delivery of oxygen can put our tissues at significant risk. Actually, a lot of times patients don't know that they're anemic, and we find out by accident on a simple blood test. But those that are symptomatic will sometimes feel tired or fatigued, which sometimes is a problem because that's similar to other medical conditions as well. Lightheadedness or dizziness are also features of anemia, and for somebody who has severe anemia, sometimes they can find themselves short of breath or pale. Sometimes the anemia actually isn't as dangerous as the cause of the anemia. For instance, somebody who has sudden anemia might be found to have a bleeding ulcer from colon cancer. And so for those individuals, the anemia was actually a tip-off to a much more major medical problem. 3.5 million Americans have anemia, and up to 10% of all women. And so the typical patient most commonly seen are iron-deficient women. And for good reason. Women have a reason to lose blood once a month through a menstrual period. And so the typical person commonly is your average female. But anybody can be at risk for anemia, especially with the different variety of causes that we see. Most physicians will say that there are three major causes of anemia. One is from a lack of production. So somebody that may have, let's say, iron deficiency, for instance, lacks the iron that's necessary to produce red blood cells. That's a decrease in production. Another cause might be excessive blood loss. So somebody who is bleeding, or let's say a woman with heavy menstrual periods, or somebody who has chronic bleeding ulcer, has a source of bleeding, they have a loss of blood, that causes anemia. And then the third cause is usually from destruction of red blood cells, and that's typically an autoimmune disorder or a genetic disorder. And so those are the three main causes of anemia. But because of the vast, numerous number of reasons why someone can be anemic, it's, I think, surprising for some patients to understand that anemia is one of the most challenging diseases that a physician can sometimes find themselves evaluating or treating.
We asked Dr. Horng how anemia is treated.
Treatments do follow the different causes of anemia, and so yes, it can depend on whatever the cause might be. Would be how we might treat anemia. So let's say, for instance, somebody has iron deficiency, we would simply replace the iron that they're missing. If somebody was bleeding, we would correct the cause of the bleeding. And so, yes, it is important that we find the cause. That's the key to treatment for anemia.